Thanks to the Robert Wood Johnson Foundation and Salzburg Global Seminar, our team has been working on a joint project to help maintain momentum around addressing childhood obesity. We highlight opportunities for immediate action to prevent increases in childhood obesity as societies all around the world adjust to living with COVID-19. We wanted to show that although obesity is a complex, multifaceted disease with no easy solution, there is still scope for government action in reducing risks for children.
After the extreme disruption of the COVID pandemic, it is vital now more than ever to support a healthy environment for children, in line with the United Nations Convention on the Rights of the Child. Of course, cost-effective actions to control the pandemic, including vaccinations and masking, are critically important to implement. We've also, however, identified 3 cost-effective priority areas for action, as detailed in a recent article published in the British Medical Journal.
Firstly, school and early childhood education settings are vital for supporting children and families through the provision of nutritious food, drinks, and healthy campus environments. We urge policymakers to recognize cost-effective opportunities for interventions within school settings as schools reopen to help truly build back better. These interventions might include nutrition standards for school meals, the restriction on sale and marketing of unhealthy food and drinks around schools, providing quality physical education, facilitating safe, active transport, and the provision of meals to vulnerable children during school closures and periods of lockdown. We know that these actions promote child health and well-being and reduce the risk for developing obesity. We call on governments to introduce these measures.
Marketing of food and drink that is high in fat, sugar or salt, but low in nutrients is a key environmental driver of obesity risk. Of concern, this marketing is often targeted to children. Unhealthy food and drink marketing is pervasive across digital media, and as children spend more time at home because of the pandemic, using screens for education and for connection, we must protect them from unhealthy digital environments. We're calling for governments who have not yet done so to implement a ban on unhealthy food and drink marketing targeted to children across all media. This intervention will protect children from targeted marketing with equal benefits likely across socioeconomic groups.
Finally, sugary sweetened drinks contribute to poor dietary intake, and these are associated with increased risk of obesity. Changes in eating behaviour in some regions during the pandemic have been shown to include increased consumption of unhealthy comfort foods and drinks. Whilst only one part of the wider complex food environment, early evaluations of taxes on sugary sweetened beverages suggest that they do influence intake. They can also incentivise reformulation by industry and have been shown to be equitable in that such taxes do not disproportionately penalise the most vulnerable.
Putting the money raised from taxes towards the healthcare budget adds much needed funds to budgets that have been dramatically impacted by the pandemic and can improve public buy-in too. We are calling for governments who have not yet done so to implement a tax on the sale of sugar-sweetened beverages. Each of the interventions we have described are just some of the actions that can be taken right now to create health-promoting environments for our children while we build back from COVID-19. These actions form an integral part of the comprehensive strategy that is needed to address childhood obesity.